Do you believe that a simple mixture of baking soda and lemon can cure diseases, eliminate heartburn, and even speed up weight loss? Be aware that this seemingly harmless combination can be a real ticking time bomb for your body. Recent data shows that about 30% of people who follow home remedies without professional guidance end up developing serious health problems, some of them irreversible. Imagine waking up every day and without realizing it, ingesting something that silently undermines your natural defenses, overloads your kidneys, and paves the way for serious illnesses. That's exactly what can happen with the continuous use of this mixture that's so popular online. The scariest part? Often, the symptoms only appear when the damage is already done. It's like building a house on quicksand. At first, everything seems firm and secure, but over time, the ground gives way and the structure collapses. In the case of your body, this collapse can mean chronic digestive problems, severe metabolic imbalances, and even permanent kidney damage. The issue isn't just what this mixture does, but what it prevents your body from doing naturally. Our body is a perfectly calibrated machine, with its own regulatory systems that have been working for thousands of years. When we interfere with these processes with miracle solutions, we're essentially throwing a wrench into a Swiss watch. Today I'm going to reveal the whole truth about this mixture that promises miracles but can deliver nightmares. I'll explain exactly what happens inside your body when you ingest baking soda with lemon, the immediate and long-term risks, who is most vulnerable, and most importantly, what you can do to take care of your health safely and effectively. Dr. Alexander King, transforming complex science into accessible health for everyone. When we mix baking soda, which is alkaline, with lemon juice, which is acidic, an immediate chemical reaction occurs that you can even observe. The mixture bubbles and releases carbon dioxide. Seems harmless, right? But what happens inside your body is much more complex. Baking soda has the formula NaHEO3, while lemon contains citric acid, C6H8O7. When these meet, a neutralization reaction occurs that produces sodium citrate, water, and carbon dioxide. So far, pure basic chemistry. The problem starts when this reaction happens in your digestive system, which already has its own carefully regulated acid-base balance. It's like trying to adjust a clock that's already telling the right time. You're just going to mess it up. Our stomach needs acidity to digest food and kill harmful bacteria. Baking soda neutralizes this important acidity, directly interfering with the first line of defense of your digestive system. I remember Mary, a 52-year-old patient who came to my office complaining of indigestion, persistent acid reflux, and unexplained weakness. When I asked about her diet and habits, she proudly mentioned that she had found a natural cure for her heartburn, baking soda with lemon every morning for over a year. Tests revealed that Mary had anemia due to iron and B12 deficiency, nutrients that need stomach acidity to be properly absorbed. Her miracle solution was, in fact, seriously compromising her digestion and absorption of essential nutrients. The disruption of natural stomach acidity also opens the door to gastrointestinal infections. Stomach acid is our barrier against pathogens present in food. When you neutralize this acid regularly, you are essentially turning off one of your most important safety systems. Have you ever felt that a natural remedy was helping at the moment, but your problems came back even worse later? This may be the classic sign that the treatment is only masking symptoms, not treating the cause. I'd like you to reflect. Do you know the chemical processes that happen inside your body when you ingest combinations like this? Or are you relying on promises of a miracle cure without understanding the mechanisms behind them? One of the biggest misconceptions propagated by proponents of the baking soda and lemon mixture is that it alkalizes the blood, and that more alkaline blood prevents diseases, including cancer. Let's be clear, this claim has no scientific basis and demonstrates a profound lack of understanding of how the human body works. Our blood maintains a pH between 7.35 and 7.45, slightly alkaline. This value is controlled by multiple extremely sophisticated buffering systems, developed over millions of years of evolution. The lungs, kidneys, blood proteins, and even bone cells work constantly to maintain this stable pH. If the pH of the blood leaves this narrow range, even by a small margin, the consequences are serious and potentially fatal. That's why the body has so many redundant mechanisms to regulate it. No drink or food can significantly alkalize your blood, and thankfully so. Professor David Miller, a renowned physiologist at UCLA, explains that the idea that we can substantially alter the pH of the blood through diet is not only incorrect but dangerous. If it were so easy to alter blood pH with food or drinks, we would constantly be at risk of death. I had a patient, Robert, 65 years old, with a history of kidney problems, who started taking baking soda with lemon daily after watching a video that promised to detoxify and alkalize his body. 3 weeks later, he ended up in the emergency room with metabolic alkalosis, a potentially fatal condition caused by excess alkalinity in the blood. His already compromised kidneys could not compensate for the excess baking soda he was consuming. The irony is that even if you could temporarily alter the pH of your blood, which healthy kidneys would prevent, a more alkaline pH is not necessarily better. Each system in the body works at its ideal pH. Gastric juices are acidic, the small intestine is slightly alkaline. Have you ever stopped to think about how extraordinary your body is to maintain this balance without your conscious intervention? Isn't it impressive how such complex systems work perfectly without us needing to fix them with home remedies? Have you ever tried trusting more in the innate wisdom of your body instead of trying to hack it with miracle formulas found on the internet? Although the baking soda and lemon mixture can pose risks to anyone when used regularly, there are groups who face significantly greater dangers. If you fall into any of these categories, the risk isn't just theoretical, it's real and immediate. People with high blood pressure should be especially alert. Baking soda contains, as the name suggests, sodium, the same element in table salt that those with hypertension need to control. A teaspoon of baking soda contains about 1,200 milliliters of sodium, almost the entire daily amount recommended for someone with high blood pressure. Consuming this regularly can dangerously raise blood pressure and negate the effect of antihypertensive medications. For those with kidney problems, the situation is even more serious. The kidneys are responsible for filtering excess bicarbonate from the blood. When they are already compromised, they cannot perform this function adequately, leading to the accumulation of substances in the blood and electrolyte imbalances that can be fatal. Anthony, a 70-year-old patient with stage 3 chronic kidney disease, started using baking soda with lemon daily after reading about its alleged health benefits. In just 2 weeks, his potassium and sodium levels were dangerously altered, and he needed to be hospitalized with cardiac arrhythmia, a direct consequence of the electrolyte imbalance caused by the mixture. Diabetics also need to be careful. Bicarbonate can interact with certain diabetes medications, altering their blood sugar levels unpredictably. In addition, the false sense of protection can lead a person to neglect proper disease management. Pregnant women, children, and the elderly constitute another significant risk group. During pregnancy, a woman's acid-base balance is already naturally altered to accommodate the needs of the fetus. Interfering with this balance can have unpredictable consequences. Children have more sensitive and developing systems, while the elderly often already have reduced kidney function and take multiple medications that can interact negatively with bicarbonate. Do you know someone who fits into these risk groups and uses this mixture regularly? Have you considered the potential dangers to which that person may be exposing themselves? Have you been sharing miracle recipes without checking if they can be harmful to people with specific health conditions? One of the most worrying aspects of the baking soda and lemon mixture is that its most harmful effects usually come from continuous and prolonged use. It's the classic example of the silent danger, one that doesn't manifest immediately but gradually undermines your health. The first problem of continuous use is kidney overload. Your Your kidneys work tirelessly to maintain your body's acid-base balance. When you constantly introduce large amounts of an alkaline substance like bicarbonate, you are forcing your kidneys to work much harder to compensate. Over time, this can lead to premature wear and tear of kidney function, especially in people who are already predisposed to kidney problems. Masking serious conditions is another significant danger. Heartburn, for example, can be a symptom of gastritis, peptic ulcer, or even stomach cancer. By temporarily neutralizing acidity with baking soda and lemon, you may be delaying an important diagnosis. Julia, 47, used this mixture for almost 2 years to control what she believed was just persistent heartburn. When she finally sought medical help due to unexplained weight loss, we discovered stomach cancer already in an advanced stage. The symptoms that could have led to an early diagnosis were masked by the daily use of baking soda. Continuous use can also lead to chronic metabolic alkalosis, a condition characterized by excess base in the blood. Symptoms include mental confusion, irritability, muscle tremors, nausea, and, in severe cases, seizures and cardiac arrhythmias. The most dangerous thing is that the first signs are easily confused with stress or everyday fatigue. Another little discussed effect is the impact on the gut microbiota. Our intestines are home to trillions of beneficial bacteria that depend on an environment with an adequate pH. Regularly altering this pH can disrupt the delicate balance of the microbiota, leading to digestive problems, chronic inflammation, and even impairment of the immune system. When we talk about health, there's no such thing as a free lunch. Promises of miracle cures without side effects almost always hide significant risks. True health comes from consistent science-based habits, not magic formulas. Have you been paying attention to the signs your body sends, or have you been relying more on quick fixes to silence those signs? Have you considered that the home remedy that seems to be helping may actually be masking a more serious problem? Now that we understand the risks of the baking soda and lemon mixture, let's talk about what really works to maintain your digestive health, control acidity, and strengthen your immune system, all in a safe and scientifically proven way. For those who suffer from occasional heartburn, instead of resorting to baking soda, consider adjustments to your diet. Avoid very large and fatty meals. Don't lie down immediately after eating, and identify specific foods that trigger your symptoms. Small changes in eating habits often bring great improvements. Proper hydration is essential for almost all of the body's processes, including digestion. Drinking water regularly throughout the day, not just when you feel thirsty, helps maintain the balance of body fluids and facilitates the elimination of toxins by the kidneys. A well-hydrated body is more efficient at maintaining its own acid-base balance. Peter, a 55-year-old executive, suffered from chronic heartburn and was considering starting to use baking soda with lemon daily. Instead, I suggested that he increase his water intake to 2 liters per day, spread throughout the hours, and avoid coffee and acidic foods after 6 p.m. In 3 weeks, his heartburn had decreased dramatically without any chemical interference in his digestive system. To strengthen immunity naturally, focus on a diet rich in colorful vegetables, fruits, lean proteins, and healthy fats. Fermented foods like plain yogurt, kefir, and sauerkraut are excellent for maintaining a healthy gut microbiota, your first line of defense against pathogens. Stress management is also crucial. Chronic stress negatively affects virtually every system in the body, including digestion and immunity. Practices like meditation, deep breathing, regular physical activity, and adequate sleep aren't just good advice. They're powerful medical interventions with robust scientific evidence. For those seeking a natural digestive aid, herbal teas like chamomile, ginger, and peppermint can be safe allies. Unlike baking soda, these alternatives work in harmony with the body without disrupting its natural systems. Supplementing with quality probiotics under medical guidance can benefit people with certain digestive problems. These live microorganisms help restore the balance of the gut flora in a much more natural and safer way than chemical interventions like baking soda. Perhaps the most important tip is listen to your body and seek professional help when needed. Persistent symptoms such as heartburn, abdominal pain, frequent indigestion, or bowel changes are signs that something may be wrong and deserve medical attention, not home experiments. Have you tried these natural alternatives before resorting to potentially dangerous mixtures? What has been most difficult for you? Changing eating habits or resisting the temptation of quick and miraculous solutions? We have reached the end of our conversation about the hidden dangers of the baking soda and lemon mixture, and I sincerely hope that the information shared today can help you make more conscious and safer choices for your health. Reviewing the main points we covered, we saw that this seemingly harmless mixture causes a chemical reaction that interferes with natural digestive processes, compromising nutrient absorption and opening the door to infections. We demystified the false promise of blood alkalization, showing how our body already has sophisticated systems to regulate its own pH, systems that don't need and shouldn't be manipulated by home remedies. We identified the risk groups that should take extra care: those with high blood pressure, diabetics, people with kidney problems, pregnant women, children, and the elderly. We highlighted the dangers of continuous use of this mixture, which include kidney overload, masking of serious conditions such as gastritis and cancer, chronic metabolic alkalosis, and disruption of the gut microbiota. Finally, I presented safe and effective alternatives to take care of your digestive health and strengthen your immunity. Adjustments in diet, proper hydration, consumption of fermented foods, stress management, use of natural teas, and, when necessary, probiotic supplementation under professional guidance. The pursuit of health and well-being is a journey, not a destination. There are no miraculous shortcuts or magic formulas. There are, however, daily, consistent, and science-based choices that over time build a strong and resilient body. Between the hope of instant relief provided by a home remedy and the commitment to your long-term health, I sincerely hope you choose the safer path. Your body deserves that respect. If you found this information helpful, please subscribe to the channel for more content that demystifies health myths and brings reliable information based on science and years of clinical practice. Share this video with friends and family, especially those you know use or are considering using this mixture. Remember, before following any home recipe or health trend, consult a qualified professional. The internet is full of advice, some good, many dangerous, and knowing how to differentiate one from the other can literally save lives. As I always tell my patients, the best medicine is the one that respects and works in harmony with the natural wisdom of your body, not the one that tries to trick it or force it to do something it wasn't designed for. Take care. Your health is not an experiment, and your body is not a test lab for internet recipes. Until the next video, Dr. Alexander King.